Smoking addiction. The objectives for our PowerPoint are what makes cigarette smoking addicting, why is it difficult to quit smoking, and the withdrawal symptoms, how nicotine works in the body, the symptoms, the risk factors, the negative health outcomes associated with smoking, benefits of smoking cessation methods, and how does nicotine addiction affect adolescents.
So, what makes cigarette smoking addicting? It has nicotine in it and it stimulates the release of dopamine in the midbrain. Having family members who smoke increases the likelihood of tobacco use and therefore addiction. Why is it so difficult to quit smoking slash the withdrawal symptoms? After a person quits smoking, they are likely to experience withdrawal symptoms. Withdrawal symptoms may include cravings, increased appetite, weight gain, insomnia, depression, restlessness, or impatience. How nicotine works in the body. Nicotine works in the body by binding to several receptors throughout the body and causing the release of hormones that are responsible for the effects of smoking. The hormones released by nicotinic binding include dopamine, norepinephrine, acetylcholine, glutamate, serotonin, beta endorphin, GABA. The symptoms. For some people, using any amount of tobacco can quickly lead to nicotine dependence. Signs that you may be addicted include you can't stop smoking, you experience withdrawal symptoms when you try to stop, you keep smoking despite health problems, you give up social or recreational activities in order to smoke. The risk factors. Anyone who smokes or uses other forms of tobacco is at risk of becoming dependent. Factors that influence who will use tobacco include genetics, home and peer influence, age. Most people begin smoking during childhood or the teen years. The younger you are when you begin smoking, the greater chance you have that you'll become a heavy smoker as an adult. Depression or mental illness, and substance use. So people who abuse alcohol and illegal drugs are more likely to become smokers. So the negative health outcomes of smoking. You can get cancer. There's many different types of cancers you can get. There's bladder, kidney, ureter. You can get cervical cancer, liver cancer, and the biggest one, lung cancer. The pulmonary diseases include asthma, COPD, pneumonia, chronic respiratory symptoms. Some cardiovascular disease are aortic aneurysm, coronary heart disease, and then there are also some effects on the reproductive system. It reduces fertility in women, poor pregnancy outcomes, and infant mortality. And there are also other outcomes such as cataracts, diabetes, erectile dysfunction. Benefits of quitting. Improves circulation, walking becomes easier, lung function increases. After 5 years, risk of stroke is reduced to that of people who have never smoked. After 10 years of quitting smoking, lung cancer death rate drops to half that of continuing smoker. Also, the risk of CHD is similar to that of people who have never smoked. And one of the biggest one is saving money. Someone who smokes a pack a day spends about $177 a week on cigarettes, which equates to $9,200 a year.
Some of the smoking cessation methods include non-pharmacological counseling, acupuncture therapy, hypnotherapy, and massage therapy. Pharmacological, there are nicotine replacement therapies, which include nicotine gum, lozenges, patches, nasal sprays, and inhalers. Some prescription medications that are available are bupropion and varicycline, or commonly known as Chantix. How does nicotine addiction affect adolescents? Tobacco use is the single most preventable cause of death in the United States and in the world. It is even more prevalent than alcohol-related deaths in the United States. Nicotine has adverse effects on brain development, which could have lasting effects on memory and attention. Smoking around friends and siblings can also be damaging to them, as secondhand smoke is a known harmful toxin. Teens who smoke may be sick more often than their non-smoking peers and may develop lung problems or have asthma attacks. This can harm their athletic performance and their daily activities. Smoking may lead to the use of alcohol and other drugs. Smoking has a negative effect on personal appearance, for example, having bad breath, yellow teeth, or poor skin. An addiction to smoking cigarettes can function as a gateway to abusing other drugs and ultimately affect your grades and potential to continuing your education by attending college.